Okay, good afternoon, everyone. I would like to welcome you to JHAH, John Hopkins Aramco Healthcare Population Health webinar. My name is Ayman Al-Juhani, and I work for Health Promotion Unit for Population Health Department. It's a pleasure to have you today. Today, inshallah, we will try to highlight COVID-19 travel precautions. We will talk about the pandemic in general. We talk about vaccination, immunization, how is the virus is transmitted, and we will highlight the way how you get the vaccine. But before we start, this is a disclaimer. Due to the nature of COVID-19 pandemic, some information in this presentation may become inaccurate or out of date. Now, for updated information, you can visit our website, www.jhah.com, for the latest COVID-19 updates. Now, our agenda for today, we will look back at the pandemic, how it started. We will talk about the ways of transmissions, what vaccination, type of vaccination, how you get vaccination, the immunity, how you get community immunity, what are some resources, either in JHAH or outside public. JHAH, what you expect during your trip, and we will highlight some general precautions. Now, if you look back to the pandemic, the first cases were isolated from the virus was in Wuhan city in China. This was on the October or November of 2019. There were some cases that they have pneumonia, and they were isolated, and the virus was isolated then. And later on, it became a global epidemic. Now, we knew other type of similar to this virus before, at least respiratory syndrome and SARS, and they are from the same family of coronavirus. But this is a new species. Now, globally, the COVID-19, there are now more than 179 million documented cases around the world, and almost 3.9 million deaths. Now in Saudi Arabia, we have more than 473 documented cases and more than 7,660 deaths. Now this is by June 21st. Now I'm sure there are more numbers. The numbers has, but hopefully the number will go down, inshallah, by if people start to have the vaccination, and the more we are protect ourselves by social distancing, by wearing masks and gloves, and protect ourselves, we could inshallah manage and we go back to our normal life. Now, how is the virus transmitted? Now, there are different mechanisms for the virus transmission, and the main method of transmission is by droplets. Now, those droplets are tiny aerosol that if the infected patient cough or sneeze or even talk, those droplets, they could be airborne, and if someone who is not infected inhale those aerosol or droplets, he could get the virus. Now, any close contact, personal contact, touching or shaking or hugging or any social activities, that could also be another way of transmitting the virus. Another method, which is the least method, which is touching objects or surfaces that have been touched by the infected person. Now, the virus will live for a few hours. Now, if someone touched this surface and then touch his mouth or nose or face, maybe the living virus could be transmitted to the upper airway, and that could cause the infection. Now, in order to protect ourselves from the virus or from transmission of COVID-19, we have to make sure that we have a social distancing, especially if we have suspected person with symptoms, coughing or sneezing with a high temperature, or also washing our hand always and sanitizing our hand thoroughly, especially if you're going to touch shared surface or shared objects. Now, the mask is working both ways, actually. That's why the Ministry of Health and World Health Organization, they emphasize about wearing masks for both, for the infected person and for the healthy person. Now, it's working both ways. From if the infected person wearing a mask, that will decrease the distribution of the droplets. And by the healthy person wearing the mask, also that will prevent inhalation of those droplets. So wearing mask, it's a must for both. And also cleaning and disinfecting our hands before touching our nose or mouth all the time. Now, there are different tests that are done to test COVID-19. Now, we have the PCR, or polymerase chain reaction test. This is the most popular test, and this test will detect if the infection is active. Now, this done by taking a sample from the nose or from the throat, and it's done in the laboratory, and it will take few hours to have the result. Now, most of the time, the test is accurate, but sometimes it will be negative if the person, if the virus is in other part of the body, not in the throat or in the nose, maybe in the lungs. So that's why sometimes the result will be negative. But it's fairly accurate, and it's the most expensive, but it will take a laboratory and someone with expertise to do the test. Now, the other method or other test is lateral flow test, LFTs, or rapid test. This will detect the infection on the spot. It will take few minutes, up to 15 minutes to get the result. It's not as accurate as PCR, and it doesn't take, you didn't take the sample to a laboratory, but it's a quick way of testing if there is a COVID-19 positive. Now, other test, which is antibodies test, and this doesn't test the infection, but it will help us to have an idea if this person is immune from COVID-19. So those are the most popular tests, but PCR is the most popular one that's used more, or most countries using PCRs. Now, how is our body react when we get the vaccination? Now, when we get the vaccine, our immune system start to create antibodies, and it will also become in the memory of the immune system. Whenever we have same infection or similar infection, the body will create more and more of those antibodies. And also the immune system, it will train and strengthen our immune response whenever we are exposed to actual virus. So the immune system is working all the time to create and generate more of those antibodies, but also it will train our system in case of a real infection, how the body will fight the virus. Now, we have different type of vaccines right now in the kingdom, and in JHAH, Ministry of Health and other medical centers like military, Ministry of Defense, National Guard, and other major medical organizations in the kingdom. They are approved. They approved Pfizer, BioNTech, and Oxford AstraZeneca. This is the same thing that in Johns Hopkins. We also have both vaccines after approved by Saudi FDA under the supervision of Food and Drug Administration of Saudi Arabia. And also Saudi Arabia accepting other vaccines like Moderna and Johnson & Johnson. Either Johnson & Johnson, one dose of Johnson & Johnson is approved by the Ministry of Health in Saudi Arabia. Also Moderna, the two doses are also accepted by those are people who took the vaccines outside the kingdom. Now, how we get immune? There are different levels of immunity. You become fully immune, and that will be reflected if you took the vaccine through Ministry of Health, Tawakkalna application. If you receive 2 full doses, and after 14 days, the body is start to be fully immune, because within the 2 weeks time, the body is producing antibodies that by 2 weeks they are enough to fight infections. So if you receive 2 full doses or 1 dose of Johnson & Johnson, after 14 days you are fully immune. Now, also you could be immune by recovery if someone tested positive for 4 to 6 months after recovery and receiving 1 dose of either vaccines. After 14 days, this person will be immune by recovery. He will receive only one vaccine only. Now, partially immune if you receive 1 dose of the 2 doses, the approved 2 doses vaccination, and 14 days after receive that dose. So you fully immune by recovery, and partially immune. And as we mentioned, this you could be reflected in your Tawakkalna application. Now, in order to reach community immunity, we still either with the vaccination program, and we have everybody, inshallah, will have the vaccination. We still need to get to achieve the full community immunity. We have to follow the 3 W's to stop COVID-19, which is wearing. We have, even if you get the vaccination, you have to wear the mask. You have to wash your hand, sanitize, especially if you touch a shared surface. You have to watch your distance, minimize any social engagement until, inshallah, this epidemic will be over. So we need the help for everyone to achieve the community or population immunity. Now, we'll try to answer some common questions that we receive through our website. Can I combine vaccines? Lately, the Ministry of Health approved it. So you can get different vaccines, but until now, in JHAH, we're still having the same vaccines. For continuity of care, we prefer that you get the vaccine from the same center that you received the first dose. So if you get the vaccine from JHAH, it's better to get it from JHAH, or Minister of Health, you get the second dose from Minister of Health. Now, combining vaccines, there are so many studies in our research that combining vaccine could help, could improve the immunity systems, but it's not been widely practiced till now. But it's approved by Minister of Health. Now, can I get COVID-19 from the vaccine? Of course, no. You cannot get COVID-19 from getting the vaccine, because the vaccine does not have the living virus. The vaccine has more part of the virus. So by getting the vaccines, hopefully, inshallah, you will not get the virus, unless if you have infected by infected person, could be. But if you are vaccinated, either partially or fully, it will be, hopefully it will be asymptomatic without symptoms, or it will be very mild, like a mild cold or mild flu. And especially for someone who have chronic diseases or taking medication that suppress their immune system, the vaccine will help them a lot to overcome the COVID-19 infection. Now, can I test false positive after taking the vaccines? Same answer for the previous questions. No, you will not have false positive after taking the vaccination, because as we mentioned, that you only have part of the virus, not the full virus, to have the infection. Can I test false negative? Now, those tests, PCR or RFTs or other tests for COVID-19 are not 100% accurate. So there always been error, human error or machine error. But it's very, the error is minimal here. Or sometime, maybe when we do the sample, maybe the virus is not in the throat or in the nose. Maybe the virus is somewhere else in the body. So that's why maybe sometime we can be tested false negative. Now, how can I register vaccines received outside the kingdom? Yes. If you receive any of those certified vaccines from outside the kingdom, you have to prove to Ministry of Health that you received them. And you can do that by sending an email to Ministry of Health, and their email, you can record the, write the email if you want. It's moh.gov.sa@937.com. This is the Ministry of Health email for someone who has a vaccination outside the kingdom and he wants to register it. Again, the email is moh.gov@937.com. Now, how long will the vaccines induce immunity last? Now, if you have the vaccines, after 2 weeks, you will be immune. But how long the immunity, we are not sure. It maybe takes months, maybe years. We are not sure yet. But maybe this vaccine will be like the flu vaccines. Maybe we'll take it on an annual basis, or maybe they will come up with different, like a booster vaccination. We are not sure, but for the time being, by taking the vaccines, you will be fully immune. But for lifetime, we are not sure yet. But in the future, that we will know in the future. Now, how you get vaccinated? Now, who are eligible to be vaccinated? Everyone is eligible. And now, if you are taking the vaccination outside Aramco or Ministry of Health or the other private sector, or if you are JHAH patient or you are under BUPA or other MDFs, you are eligible to take it anywhere, either Ministry of Health or JHAH. But for continuity of care, we prefer that if you take the first vaccination, it's better to take it from the same center. Now, eligibility for all Saudi Aramco employees, eligible employees and the retirees and their families above and the dependents above 12 years old, they are eligible to take the vaccines. Now, how you take the vaccines? If you have an active My Chart, you can just simply use the application or use the browser. You go to JHAH, to the website, JHAH.com, and there is a notification. If you have not taken the vaccination, you just simply answer a few questions about your medical status and about some question about if you have any symptoms. and then you just book the location of the taking the vaccines. Now, locations we have throughout the company, we have either fixed like JAHA in Dhahran and Munira building 133 and Al Hassa. All JAHA center, there is a vaccination center, and also there is a mobile centers, campaigns throughout the company. And you have to watch your email. Sometimes you have the email regarding their campaigns next to you, so you can register if you are not registered yet. Now, registering, as I mentioned, use My Chart. Now, if you don't have an active My Chart, you just simply call JHAH Care Line. You can talk to someone about COVID-19, any issues, either in Arabic or English. There are expert nurses. They can assist you with any concern or questions. Now, the number you call is 800-305-4444, option 3. The line is available from Sunday through Thursday from 7 a.m. to 7 p.m. and on the weekend, Friday and Saturday from 9 a.m. to 7 p.m. Also, the social media channels, Instagram, Twitter, YouTube, you could check those channels and you could get updated about COVID-19 and anything related to the vaccination and other things. Now, after taking the vaccine, if you have any symptoms, headache, nausea, or not feeling well, temperature, high temperature, coughing, sneezing, you could immediately call us, or you call the Ministry of Health hotline 937 and report it, especially if you take the vaccines with Ministry of Health. If you're with JHAH, you can call us and to the care line, JHAH Care Line. And if you're not feeling well, you can come directly to the hospital. Now, for recording, after you take the vaccination, immediately you will receive an SMS that you took the vaccines, and you will have the appointment for the next vaccination. Now, after you take the either 1 or 2 vaccination in Tawakkalna application, you will have this recorded in your file, in your mobile. Now, let's talk about some tips and what are the risks and consideration while traveling. Now, traveling in general may pose additional risks. Now, some countries the COVID-19 is not fully contained. So it's better to avoid traveling unless if it's necessary for emergencies. Now, vaccinated travelers are less likely to get infected, but they can increase transmitting the virus. Now, if you have someone with you who have not get the vaccine, for example, or young ages below 12 years old, so they can catch the virus and they can spread the virus to others. Now, that will pose additional risk. And also, with the new variants, COVID-19 variants, now we have to be careful. Now, though the vaccines, usually they are working on variants and they are working on different types of viruses, COVID-19 variants, but still there is increasing risk by also spreading the virus. Now, with the situation is different from one country to another. So our travelers are encouraged to pay very close attention to the condition of the destination, the countries that they are going to. They have to watch if any outbreak or if there is any situation that need to be, or even to cancel or postpone the travel for any of those situations. Now, there are some factors that could affect the risk of either increasing or decreasing the infection. Now, what country you're going to? What's destination now? How long you're staying, or are you passing by some countries? So you have to make sure also not only to the final destination, but the transit destination, how long you're spending time with at the airport, what type of transportation are you using? Are you using public or private transportation? What type of trips or activities you will be doing during your trip? Are there any quarantine or testing procedure done in this country? How good are those tests and procedures? If you are traveling with someone who has immunocompromising condition or taking immunosuppressive medication, those they need extra care, and they prefer that they, rather than traveling, they postpone their travels if they could, because those patients are at high risk, especially with the new variants of COVID-19. People that you're going to be dealing with when you're traveling, their health status, and what type of contact do you going for leisure or you're going for business. So all you have to ask yourself all those questions before traveling. Now, also for exits and re-entry. Now, before you exit the kingdom, you have to check the current COVID-19 situation, a requirement for your destination. Also check the airplane boarding, and while traveling any layover or transit ahead of time, you have to be at the airport ahead of time for the extra procedure that they are taking in all airports, and stay up to date with any update. Make sure that you understand and you follow the airline and transit and destination requirement related to your travel. Those are general precautions, but you have to follow them all the time by wearing masks, by keeping a distance, by testing PCR if required, by presenting a document of vaccination, and in case for quarantine if you've been kept for a few days. Now, failing to meet those requirements may result in denied boarding and denied entering, and maybe there is additional expenses or penalties upon you. Now, when you're entering, now with the current quarantine mandates for re-entering Saudi Arabia, it depends on several factors. Make sure that you understand and you follow these mandates. Now, if you fail to meet any of the kingdom requirements, that might result in institutional quarantine at your expense, or maybe there are other measures and penalties if you don't follow those mandates. So you have to be ready, you have to check all the requirements for exit and re-entry before traveling. Now, there are items you have to be with you before traveling, and those items are very important to facilitate your travel and make sure that you don't have any situation while traveling. Now, you have to have smartphones with you, more than one smartphone, to have extra chargers, and you have to have a mean of internet connections all the trip during traveling and the country you're traveling to. Now, all countries, they require the health insurance policy, and you have to purchase the insurance policy before traveling. That will cover you your health insurance while traveling, only for COVID-19. You have to present your health status and or vaccine certification, or the health passport as well, Saudi Arabia, and you can have a digital health passport through Tawakkalna. You have to do a PCR test within 24 to 48 hours prior of traveling, and it should be negative. And it should be approved. One of the certified certified medical centers by Ministry of Health. You have to have the airline application, and in case if you have any SMS notification, make sure you get those text messages or have a digital boarding passes in your mobile, screen capture of Tawakkalna, of your health status and the health passport as well. Print out of all the documents like vaccine certification, PCR test, any health application or paperwork required at your destination. You have to have those prior of the traveling, hygiene supplies, sanitizers, gloves, etc. And it's preferable to have all your essential medical and personal items in a carry-on bag. So especially when you are boarding at the airport, it's better to have all your items in one carry-on bag. Now at the airport, due to the additional precaution, you have to allow extra time. You have to arrive to the airport ahead of time for each leg of your trip to make sure that you don't, you have all the document and you follow the instruction of the airport staff and the passport staff. Vaccination status should be with you, Tawakkalna. Usually at all airports, they will check your temperature and they will be asked prior to entering the airport if you have any symptoms before you checked in, to have allowing more time for checking in. While you are at the airport, you have to follow extra social distancing. There are so many people boarding and leaving the airport. So extra social distancing and hygiene precautions, and make sure that you clean your seats at the airport before you sit on it, and only remove your mask only if you are gonna eat or drink. And you have to follow any special instruction given by airport personnel or by passport control staff. Now, on the plane, the boarding and disembarking will be very closely more organized by the staff on the airplane. Not allowing, usually they're not allowing any standing in the aisles. This is restricted to avoid the transmission of the infection. Some laboratory restriction may be introduced. You remove mask only when you eat and drinking, and usually, and because of the special circumstances, there are changes in the timing of delivering food and beverage service on some airlines. Now, some extra measure may be applied if you are traveling with infants and children. Make sure that you sanitize your surrounding and wash and sanitize your hands frequently. Now, many people are concerned about catching the virus while traveling, but our airplanes are equipped with a good ventilation system that will minimize the transmission of not only COVID-19, but most of the viruses. So being on the airplane actually is very safe with the good ventilation system. Now, if you're gonna use public transportation, we don't really recommend using public transportation, but if you're gonna use them, you have to make sure that you follow extra precaution by wearing mask, especially when you are riding a taxi or buses or train or any other form of public transportation. Cruise ships may carry additional risk, and for the time being, it's better to be avoided. And some forms of public transport maybe require some advanced seat booking. So make sure before you go to the public transportation to check if there is any previous booking or advanced booking. There is going to be extra spacing and capacity measure may be added, and that will add additional time and expenses. But generally, it's better to use private car, rented car, or taxis, because the renting cars and taxi, they are following a restricted policy of cleaning and disinfecting the cars after used. Now, If when you are riding with a taxi, it's better to sit on the back, to be on the back seat, not on the passenger seat. Now, during your trip, always maintain social distancing, at least 2 meters, and to avoid crowding. Avoid the contact with anyone who is visibly sick. Use coughing etiquette or sneezing etiquette by covering your mouth and nose with your elbows when you cough or sneeze. Uh, Definitely, you have to sanitize after sneezing or coughing, and you have to sanitize your hand very often. Take special precaution when you are doing any outdoor activity, when you are with the group, or when doing any sports activities. Continue to wear the mask for any indoor public spaces and outdoor spaces with that carrying a high risk of transmission, like public events or large gathering. Try to refrain from eating or drinking on public transportation. Disinfect your luggage and carry-on after collecting from the airport or if using any public transportation. Make sure that your accommodation has published hygiene measured and disinfect the surface of your hotel room. You do it yourself after you take the room. Refrain from dining at buffet and generally avoid unpackaged snacks or street vendors. Now, there are some general precautions we have to follow not only during the pandemic, but all the time. Either we're traveling or not traveling, always you have to maintain a healthy lifestyle, especially when you're traveling, by drinking fluids, drinking enough water, eat balanced meals, get enough sleeps, and avoid unprotected or prolonged heat sun exposure. If you feel sick, if you have any discomfort, and if you come in close contact with a known positive case, you postpone your trip or your activity if possible and notify the health authorities and seek medical advice and isolate yourself until you're given further instructions. Now, how to end the pandemic? By registering, if you're not registered yet, to get the vaccines and protect yourself and others, and hopefully we will go back to our normal life. Thank you to be with me.